presentation. A few words about Claire Levy, our Boulder County Commissioner, District 1. She was elected at that capacity or position on in November 2020. And as a commissioner, she's really eager to work at increasing access to affordable housing and economic security, protecting our environment, renewable energy, fostering racial equality or equity, diversity, and inclusivity in Boulder County. And Claire Levy, Commissioner Levy, has a really impressive record of service as a state house legislator. It's an honor to have her talking at BoulderNet. She was representing Boulder, Gilpin, Clear Creek, Grand, Jackson counties from 2007 to 2013. She served as Speaker Pro Tem, Majority Whip, Vice Chair of the Joint Budget Committee, Chair of the Appropriations Committee, Chair of the Judiciary Committee, and she served on a number of ethics investigation committees. After her tenure as a representative, she became the executive director of the Colorado Center of Law and Policy, which is a nonprofit that advocates for health and economic security of low-income Coloradans. She also served the people of Boulder County for over 25 years in a voluntary capacity on the Boulder Planning Board, the Boulder County Parks and Open Space and Advisory Committee, the Board of Plan Boulder County, as well as Boulder Arts Academy and Boulder Ballet. And also she was a board member of the Boulder Housing Partners, the city's affordable housing provider. She also is a former member of the statewide Access to Justice Commission. And just some personal notes, Claire has 2 daughters and she has a husband who happily retired from the National Oceanic and Atmospheric Administration. So it's possible to make it through and retire one of these days. And she is happiest hiking in the wilderness and county open space, sometimes with her rescued greyhound. And she enjoys other things like reading and talking about current events. So without further ado, I'm going to hand it off to Claire Levy, and I bet we're in for a really good presentation. And I should say, after Claire's talk, there should be ample time for questions and to receive answers. If somebody has a pressing question during her talk, I would say, jump in if you are diplomatically, if you diplomatically do so, I should say. Okay, Claire, it's your time now.
Well, thank you, Michael. You did your research, and
I could write, a book about your experience.
Yeah, thank you. Well, there's a slide, the second slide. I don't want to screen share just yet. I'd like to just see you, and when I just say good morning and thank you for having me. But the second slide, I guess, is supposed to be where I tell you who I am and what my background is, but I think Michael covered it. Before I do start into what I was going to share with you, I just want to say how interesting it was for me to hear your introductions, because I have lived, so I'm an attorney by training. That's what my profession was before I ran for office in 2006. And so I actually practiced law for 25 years. Being a politician was not in my, not on my radar screen. It wasn't something I ever aspired to. but I sort of stumbled into it. And I spent the 25 years I practiced law. I was a public defender for 4 years in Denver in the appellate division. So I did appeals of serious felony cases and appealed to the Colorado Court of Appeals and the Colorado Supreme Court. And so I started out as a criminal defense attorney, and that was what I thought I was going to do for my career. And then an opportunity came along to move into the civil side of legal practice up here in Boulder. I was living in Denver, and it seemed like a good idea. It seemed like an interesting career move, so I did it. Turns out I didn't really care for it too much. But I found that what I was becoming increasingly interested in, and this is in the mid 80s, was the issue of growth, population growth, urban sprawl, suburban sprawl rather, preserving open space. Just, what do our communities look like, and how do we design those communities so that they build actual community and not just a lot of pavement and cul-de-sacs and consuming farmland. So this was a period in which Colorado's growth was just explosive. And I think for whenever you move here, that's the period where you think Colorado is perfect, and everything that comes after that is too much growth. So I moved here in 1982. Anyway, so this was, it's the growth has continued, but I think we've actually learned that suburban sprawl is bad for the environment. It's bad for people. But I practiced law as a land use attorney for a lot of years, and during that period was when I just started getting involved in in those issues kind of on the side, and it was my job to do those things. And life, I had kids and working full time, living in Boulder, working full time in Golden was not working out for the kids. So I decided to practice law part-time out of my house. And that's when I really just started getting much more embedded in the Boulder community. And it wasn't like I wasn't intentionally networking, it just sort of happened. And I think just for what I've been hearing from all of you, and the lesson that I've taken from my life, and what I have told so many people who have wanted to talk to me about the decisions I made and how I got where I am, and even talking to my own kids, it has been, you can't lay out a path in life and assume that that's the path you're going to take, because you're going to miss a lot of opportunities. And like I said, I started out as a criminal defense attorney, never, ever, ever, ever intended to be a candidate, just never. And I've now held 2 elected offices, and I've enjoyed it. So, my message is, just never say no. I took a job I didn't like and I left it. And that ultimately set me on the path to be where I am today. So what I had planned to talk to you about, I think maybe isn't what you were looking for. And because I took it from, so Michael reached out to me when I was sort of barely finding my way around my new job. And so he sent a message and said it would be great if you could talk about all these things. And what I have for you, I tried to do my research on BoulderNet, and I guess I did not realize that you were primarily like a job search networking group. I thought you were just maybe more of a just networking group about interesting people and interesting conversations. So what I'm going to share with you is actually information about where Boulder County is regarding the COVID-19 pandemic, our response, our recovery, what the data is showing about where we are, and then some information about how that has affected the local economy. It's probably, I guess when Michael and I finally talked with one another a couple of days ago, he asked me to include some more information about the business environment, and that's not really something I have, other than that I sit down and I meet with the Boulder Chamber of Commerce every few weeks, and so I do have those relationships. But I'm going to start sharing my screen here pretty soon, and I would love for you to just interrupt me if you'd like to ask a question. The last thing I want to do is talk at you for however long it takes to get through these slides, and not be addressing what you'd like to know. So let's see whether, with all the accomplishments that Michael described for you, let's see if I can do the most important thing, which is share my screen, make this slideshow work. So I think I now know I need to select screen number 2. Tell me what you see.
It's good.
Do you see a big slideshow?
Pandemic response and recovery.
Full screen?
Yes.
Yep.
Yes.
Beautiful. Okay, now the next test of my ability is whether I can advance. Yes. Okay, do you see my background?
Yes.
Okay, wonderful. All right, here we go. And I'm going to skip the background. We already covered that a little bit too much. And so what I think, so the impact of COVID, we might say, well, why, we've all lived through it. Aren't we all experts on this? And in some ways, each of us is, because we've all had our own experience in this pandemic, and it's something that we'll carry with us for the rest of our lives. But we know our experience with this pandemic. We don't know others in some instances. And I think for me, being a county commissioner, and maybe I should tell you a little bit about what being a county commissioner entails, but it has given me a window into the experience of the pandemic that I wouldn't have just in my own experience. My own experience was really not a bad one. I was running for office. The pandemic interrupted what is a normal campaign, which is to go to a lot of meetings and meet as many people as you possibly can, and spend a lot of time in close quarters trading germs. And so the pandemic meant that I was really hard to meet people. So instead, I did a lot of hiking, and and that was just delightful. But what county commissioners do is in part, it's the policy stuff that Michael told you are my interests, but to a greater extent, it is just being the co-CEO of the county. We have over 2,000 employees. We have a budget of $450, $500 million. The county commissioners, 3 of us, are co-CEOs. We make decisions for our staff, just as any of you, if you were in that position, would make in the private sector. So understanding the pandemic and how it's affecting people and making decisions about how to respond is a big part of it. So Boulder County created a group that drew from leadership across our departments and across our elected officials, called ProBoCo, which is the Pandemic Response and Recovery Organization for Boulder County. And we, I think I lost my notes. All right. And so the initial period was to address, the actual response, which is getting information out to the private sector about how to be safe, distributing PPE, those things that were really about how do we contain this pandemic in our community. Most of that really was the job of the public health department, which is not, it's a department of the county, but it reports directly to the Board of Health, although the county commissioners are very involved in what they're doing. You see here our mid to long-term recovery timeline really is, from next month and through, December of 2022 is, seeing that transition back to health, back to having people go to work. What does our transportation system need to respond to that? What do businesses need to respond to that? How do we respond to the unmet health needs that have really surfaced and become primary, just very, very apparent during the course of this, given the disparities, which we'll talk about in a minute. I want to make sure that the slides are advancing. You have timeline on the screen in front of you. Is
Yes.
that correct? Good.
Yeah.
And then also simultaneously, we're going to be addressing what we look like on the other side. So because of the American Recovery Plan Act that Congress passed almost immediately upon President Biden taking office, we're going to have $64 million at our disposal here in the county to address revenue shortfalls, address some of the direct expenditure requirements that we have as a result of the pandemic. But also, I think the commissioners, my fellow commissioners and I, along with our department heads, really feel that this is a once in a lifetime opportunity to see if we can change things up here in Boulder County to make a stronger economy, create a stronger, more enduring safety net for people, address these health disparities that have led to disproportionate impact on people of color in our Indigenous community. And so as you see that timeline here to 2024, that's how long we have to spend this money to try to put it to really productive use and build resilience so that, as we say, we can build back better. The recovery goals that we have created, the initial stage was, and still ongoing really, to prevent and mitigate the spread and impact of COVID-19 to the general community, and primarily among people for whom isolating at home is not practical. And so we've had weekly status updates on percentage of positive tests, hospitalization rates, all of the data that tell us how good a job we're doing at containing the virus within our community. As I've said several times, and you'll hear me say many more times in this presentation, we need to identify and respond to the inequities related to both the primary impacts, i.e. higher hospitalization and death rates among lower income communities and people of color, and then also address the secondary impacts, which have been that people in lower wages have endured much higher rates of unemployment. Their jobs are coming back, but their wages aren't really enough to help them cover the costs of working, basically the cost of childcare and things like that. Higher rates of unemployment and underemployment among women and women of color. So, we need to be addressing those issues as we try to build back from this pandemic. As we receive that $64 million, which is a really staggering amount of money, make sure that we're accountable to the community and people trust in the ways in which we're using that money, and that everybody can see that it is actually helping them recover from this historic pandemic. So I want to delve a little bit more into this first goal of preventing and mitigating the spread and impact of COVID-19. You can see here, and I've got to change one thing on my screen because it's covering up the graph. we've got two groups of data here. One is the 7-day average of the number of new cases of COVID among Boulder County residents. And this starts back in March of 2020. And you can see this real spike here in November of 2020. And it's coming down. It's doing exactly what we would like it to do. There's a bump up here in March of this year, whether that was related to the student riots on the Hill, whether it was related to people just deciding they'd have enough of this pandemic and they're going to resume normal life, we don't know, but it's now starting to come down. And this is probably the effect of the vaccine being very widely available within our community. So here we've got, beginning in January of 2021, the number of Boulder County residents who are testing positive for COVID-19. And this is a breakdown by race and ethnicity. The bottom darker color here is people who identify as white, non-Hispanic. This orange is self-identified Hispanic, Latinx, and then on top we have any other race that is not white and not Hispanic. And you can see, well, I don't have the comparison of what are these representations within our general population in Boulder County, but it has disproportionately impacted our Latinx community. And that's where we need to be addressing our recovery response. So the good news at this point is that while hospitalizations initially had been increasing just as the governor was moving us into clear status, that is a lagging indicator, as you can probably intuit. People generally, they get sick enough that they need to be hospitalized several weeks after they test positive, and they may test positive several weeks after an exposure. So although initially hospital rates were rising, they are now coming down. Same for statewide hospitalizations, but they're now coming down. Deaths, fortunately, have been declining, and 5 people died of COVID-19 in April. I don't believe we've had any additional deaths. And so, so that there's good news on that front as well. And I have notes in this presentation that would have allowed me to elaborate on all of this and sound like a public health expert, which I'm not. So because my notes disappeared, I'm gonna just sound like a person reading slides who's not a public health expert. So we are really, really, really proud of this number here, 70%, which has probably gone up by a few fractions of a percentage point. This is the total number of Boulder County residents who have received at least 1 dose of the COVID-19 vaccine. And we need to get to a higher number. We need to keep moving. And we need those single doses to transform into a full course. But we are doing very, very well relative to our peers in the Denver metro area. And we'll see if I have a slide here in a second that will show you these numbers broken out by age. I don't think I do, but among people who are age 65 and above, we're approaching, if not at 90%, and that of course is the most vulnerable age. Here we do have that broken out. That's where the majority of the deaths were, and so that's why the vaccine priority started with people in the age 70 plus group, people with vulnerable health status, people in the medical professions. You can see that a full course for people age 70 plus is up at 90%. That's, I think, really phenomenal. You know, it goes down as people get younger, but I think now that vaccines are widely available, you can walk into King Soopers, Safeway, most pharmacies, walk up to the counter and get a vaccine, and that's the way it should be. We do see these vaccination disparities by race and ethnicity. That's something that our public health department is really, really focusing hard on trying to address. And so we have a vaccine equity coordinating clinic, which is taking mobile vaccination clinics into communities that may be reluctant to go to a doctor's office, a public health clinic, because of immigration status, because of language barriers for whatever reasons. So we're really focusing a lot of effort on trying to reach out into those communities and address these disparities in vaccination rates. So this photo shows you know, a traditional vaccine clinic. You probably all visited one similar to that to get your vaccine, and I hope you have all been vaccinated. That, you know, it requires the ability to get an appointment on a digital device of some sort. It required transportation. It required time off work, perhaps. And those are things that, you know, those of us in the dominant culture and with education and means were able to access quite easily. But among people who have language barriers, who work in jobs that don't have flexibility, who you know, are reluctant to go to a vaccine clinic, that's where we've seen the challenge. And so that's why we've had these equity clinics for people who do have limited mobility and other challenges. So you know, we're trying to overcome this vaccine hesitancy. We're making progress in that regard. I think a lot of that is word of mouth as we increase vaccination rates in communities of color. And then, you know, they share that experience with their friends, their colleagues, their community. We're hopefully making some progress here. So we have you know, just a representation of who's willing to get vaccinated. In February, this is a little bit outdated, February 2021, relative to what people expected in September. And you can see that among African American and Black Coloradans, people who identify as Hispanic or Latinx, you know, there was quite a bit of hesitancy, and we're trying to make up for that. This is Dr. Sheila Davis, who is in our public health department, who has been leading this vaccine equity campaign. And they've been doing a lot of that through town halls that they've been holding online that are very accessible. And then now that it's safe to do so and the weather has improved, going out into communities to address this vaccine hesitancy and communicate through trusted partners. And that's a big part of this is identifying those people who are trusted. And that may not be somebody like me, who's white and does not speak Spanish. It might be somebody from your community. You know, we have cultural brokers who are willing to go and do that work, and we value that work very highly. So these equity clinics, as I mentioned before, they're some of them are mobile clinics. In some instances, we basically just set up a vaccination clinic in a facility in the community. So in Longmont, we've partnered with Salud Family Health, with the city of Longmont, and have run clinics twice a week at the Lashley Street Station in Longmont, which is a place that's very accessible. We have a hub in Lafayette that houses a number of health public health organizations, and have been there several times a week. The fairgrounds is a place where we've been setting up clinics. So we're really trying to get into the community and make it pretty much impossible to not be able to get access. Our clinics are, I think, becoming very effective. We're making them very culturally appropriate and welcoming, regardless of what the community is. As I said before, really leaning heavily on community partners with that issue of culturally appropriate. So it's, the people who know those communities best advising us on how to approach and make these communities welcoming. This picture is really a beautiful picture that was in the paper of a vaccine equity clinic. And you can see that it's people, it's your neighbors, it's hopefully not intimidating. It's people who speak your language, literally, who are welcoming you, and then walking you in if that helps you feel more safe. This was one that was hosted by the LGBTQ community in Longmont, and also partnering with Latino communities. The ambassadors, the cultural brokers who I mentioned before, these are really trusted community members who may be associated with nonprofits or community leaders. They're people who really know those communities well. And they've been doing outreach and registration through the organizations that you can see on the screen here, distributing information, making sure that folks know that we're there, that we want to help them, we want to work with them, and that there will not be any immigration consequences of doing this. You're not going to end up on a list. We just want people to be safe. This is just a screen. I doubt any of you need it, but if you do, I can leave it up for a while. But this is how, if you haven't been able to find a source of a vaccine, or you're questioning your eligibility, at this point, everybody's eligible. There are no priorities anymore, but information's pretty readily available. So that's all about, where are we right now, and what have we been trying to do to make sure that people have access to vaccines and can be safe and healthy. As we move along, then we want to really try to support a stronger, more diverse, and more equitable community, and respond to the inequities that are related to these secondary impacts. And the secondary impacts have been job loss, it's been interruption in education, it's been, what some of you may be experiencing, in that it's much harder to network if you are looking for a job. So for the communities that Boulder County's Community Services Department and our Housing and Human Services Department serves, one of those secondary impacts has been increased need for food and rental assistance. So this slide here above shows enrollment in the Supplemental Nutritional Assistance Program, SNAP. And that enrollment had been declining. It is a difficult program to access. The benefits are not very good. The documentation requirements are burdensome. I say all these things, and they are such not because of Boulder County requirements, but because of state and federal requirements. In the pandemic, those food assistance benefits were increased. We're hoping that they will stay higher. You can see more people accessing those benefits, and it's very important that that be available. Rental assistance was something that fortunately was very immediately recognized as a need. And Congress funded it, the state legislature funded it. We have in Boulder County, 60% of households are renters. And with no job, there's no money to pay the rent. The last thing we needed was for people to be evicted and have no place to go. So rental assistance became a very important aspect of keeping people safe and addressing inequities. The Boulder County Department of Housing and Human Services was able to distribute almost $4.5 million to food banks, to healthcare centers, family resource centers, to make up the gap in what they ordinarily would have had and what the need was that we were seeing in our community. Childcare was something that really came to the fore as an essential service, and we've known for a very long time that it's too expensive and it's not adequately available. Well, now when schools are closed and school-age kids are home and they need adult supervision, and you are working in an essential business, what are you going to do? Child care centers closed because it wasn't safe to operate them, or the people who staff them did not feel safe coming to work. So we did put quite a bit of money into trying to support those child care centers, keep them open so that parents could go to work when they needed to. One thing we've seen, which is going to be an ongoing need here for the next several years, is a dramatic increase in mental health and substance use disorders and the need for services. This is just an absolutely tragic result of this pandemic. It's a consequence of isolation. It's a consequence of just the feeling of being in a pandemic. So emergency department visits for suicidal ideation. You can see the numbers 34% higher in 2021 than in 2020. Emergency department visits for suicidal attempts are up dramatically, and for our youth, this is just something I just can't stress how important it is to understand that this isolation and not being able to go to school and not being able to socialize with your peers at that age, it can just have incredible consequences. And we've got to direct resources at this. 93% increase among these young children at a time when they should be playing and learning and growing. Isolation, not being around people, has made it all too easy to overconsume alcohol, to consume opioids and other substance uses or substances that maybe you were in a support group before, that support group disappeared, people would see you, they'd check in on you. Now you're isolated and you return to using where maybe you were trying to make some progress overcoming that. The legislature was able to direct some immediate resources through the CARES Act, federal funds, to address the substance use disorder treatment and community mental health centers. This has been a significant subject of this legislative session in trying to get additional resources for mental health treatment, behavioral health disorders. There's been a group meeting here in Boulder County about the potential for putting a tax on the ballot so that we can have a countywide source for ongoing treatment of mental health needs. I think this is, it's been an unmet need in Colorado and in Boulder County for many years, and the pandemic has just really brought that to the fore. Getting now to the impact on employment and economic well-being. So this is something you probably didn't expect to see, which is, so this top line is people who are in a higher wage. I would not call $60,000 a year high wage, given the cost of living in Boulder County, but surprisingly, employment actually did just fine for that group. That's the group for whom working at home was probably more feasible. Middle wage jobs, fell dramatically, but have really come back. Zero is kind of where we started, to just about where they were, just down slightly, 1.2%. It's the low wage jobs that where employment rates have continued to be low. Now, you're reading in the paper about demand for employment, demand for labor among low-wage workers. This is the hospitality industry, the direct service providers. And I think the fact that unemployment is still high reflects that people don't feel it's safe to go back to work, and they probably don't really think that they should go back to work for the wages that are being offered. And this is going to be a challenge to our economy, to increase those wages, provide paid sick leave, provide assistance with childcare and those needs to an extent where people feel that they want to go back to work, all the while that the businesses that need to provide those wages may not feel that they have the ability to do so. It's sort of a cycle that we'll have to figure out how to break, and perhaps some of that $64 million that's coming to Boulder County and additional funds that are coming to our municipalities can be put to that use. So the unemployment rate, going into the pandemic, we were at historic lows. 2.4% unemployment is essentially full employment in any economy. And we're double that now, even though the unemployment rate has declined significantly. So a lot of people, and unemployment, you may know this, those rates reflect people who are looking for work. They do not reflect the labor force participation rate, which is a different number. Labor force participation is people who are of prime working age and who are not in the economy. So that number, I don't have a slide on that, but I believe we have about 40% of our working age adults who are just not in the economy right now for a number of reasons. So this unemployment rates always reflect people who are actively looking for work. So Boulder County hosts a workforce center, Workforce Boulder County, which assists people in their job search. It provides resources such as how to write a resume, how to prepare for an interview. It provides other support such as training needs if you need to get a credential to be eligible for a job. So the calls that have come in have exploded here during the pandemic, and we're fortunate that we've been able to field those calls and help people who are ready to be in the workforce. These are some of the services that I mentioned that are provided by Workforce Boulder County: career coaching, if you need assistance in how to access the digital resources. This group seems quite tech savvy. You all work in high skill fields, so you probably wouldn't feel that you need these services, but we do offer them to people who don't have the means and the education levels that the people in this group have. So, small businesses, I think, have probably taken the brunt of the economic impact in this pandemic. The larger businesses that are more diversified, who had the resources to quickly switch to an online digital platform, probably were able to move into that space a little more easily. But, small business revenue, you're seeing this right here. These are your independent businesses, your restaurants, folks that, have a small number of employees that don't have the flexibility. That revenue also translates, as far as the county is concerned, into inability to pay property taxes and things like that. So that's something we really need to focus on. Small businesses are probably the last that are going to be able to reopen as restrictions are lifted, because they may not have the ability. I'm thinking again primarily of restaurants, and the hospitality industry may not have the flexibility in that regard to have the spacing and afford the kinds of air circulation improvements and things like that that people are going to want. So this is just a picture of how, we've really tried to market what it takes to be safe in the economy, and really tried to get the word out to businesses on the resources that are there for them. So I think I've got a few more slides I wanted to share just quickly here on what we were able to do with the tranche of funding that we got through the CARES Act. We had $1.3 million that the county distributed in small business grant programs. We shared that money with the municipalities in Boulder County, and we're able to make small grants to a lot of businesses to help them with initial pandemic response needs. We did a very, very good job, if I may say so myself, at getting that money out into the community. We were one of the few counties that actually was able to distribute all of the money that we were allocated. And we did that by strong partnerships with our Economic Development Commission, with the Chambers of Commerce, and with our municipalities within Boulder County. Addressing here how we're getting those resources out into the community, and really understanding what the business needs are and what the employee and workforce needs are in Boulder County. I'm going to speed this up a little bit more because I really would like to move into the Q&A and discussion part of my time with you all. But this slide just shows the really large group of entities that Boulder County partnered with in order to distribute the $1.3 million that we had through that initial CARES Act. Everything from the Community Foundation of Boulder County, Longmont Chamber of Commerce, the Latino Chamber of Commerce, Downtown Boulder Partnership. You can see them all here on the screen. And then, moving into resiliency and recovery. So what does that look like? I think that's an area where, we probably each have our own stories to tell about, well, how did it feel when we were told it was safe to take the mask off and socialize, or, with people inside? Were you ready to do that initially, or were you hesitant? Do we feel that we're ready to go back to life, to normal life? And I think, we're very resilient creatures. Human beings are. We know how to manipulate our environment very, very successfully. And we're very adaptable. And I think, I know, just speaking for myself, I adapted in a way that I never thought I could to this kind of social isolation. And now we have to adapt to coming out of that social isolation again, and addressing the needs of our community, continuing to keep all of these issues on the front burner around climate change, around our economy, around addressing housing needs, around all of these things. All of this will go into our recovery. So I'm going to come back to the core issues that we know that we need to address as we move into the recovery phase. We need to address the disparate impact that COVID-19 has had on people in low-wage jobs and people of color, the continued financial strain that small businesses are going to experience because they have fewer resources, and often what we're hearing a lot is that it's going to be difficult to meet that property tax bill that is coming due, which is part of a triple net lease. Addressing the need for employees. What's it going to take to entice those employees back in to the job market? Their skills may have become rusty during this period of forced unemployment. Address climate change and innovation, and how can we not go back to normal as far as our commuting patterns. We've consumed an excessive amount of plastic, single-use plastic during this period. The impact on mothers and children, childcare and education. Mothers were the ones who generally stepped away from the job if there was a two-income family and both were working at home, and one of them had to homeschool the kids. And so that also represents a loss of earning capacity and time out of the workforce, which is very hard to make up. And then finally, but by no means least, the ongoing mental health and substance use needs that our community will have to address going forward. So let's see, now I have just lost the ability to, there we go, to advance these slides. We're back again. I mentioned we're going to get $64 million over 2 years. The US Treasury Department is putting out very detailed guidance on how we're allowed to use those funds. We're going to try to be very, very creative in that regard. We do have some immediate needs to just replace the lost revenue that we've experienced in Boulder County. Thankfully, property tax, we won't see that property tax hit for another year or two, and sales tax, after an initial dip, has come back pretty strongly, but there will be some immediate revenue impacts we'll have to address. We're going to want to find ways to stabilize the financial situation of households and small businesses, and then address the systemic public health and economic challenges that we've been experiencing in Boulder County. So initially I had thought that I would spend a little while addressing what all of this means for sustainability, climate action, and resilience. But I understand from Michael that you are going to have somebody in the near future, I believe, from our Office of Sustainability, Climate Action, and Resilience, otherwise known as Oscar. And so I'm not going to do that now. I don't want to duplicate that, and I feel like I have been talking long enough. I don't like to talk this long without hearing from people. So I'm going to stop sharing my screen. Although if there's a slide you're interested in returning to, I'm happy to figure out if I can do that. So we're now hopefully all seeing one another again. And I'd love to just talk here and talk about what all this means for you, for how you see this recovery stage impacting your lives, whether the pandemic has affected your career desires, your career prospects. There's a phenomenon, I think maybe among younger people, but maybe not, that I've been reading about, that is, feeling like, hey, you've come really close to seeing your mortality, understanding what's really important to you. And, they're calling it the YOLO phenomenon. You only live once. So do you want to be in a job that really doesn't provide meaning and value to you, or do you want to use this hiatus to find something that's much more meaningful? You know, what really is important in life. So I think this period has given us a lot of time for self-reflection, a lot of time to think about how we relate to our fellow community members, a lot of time to think about unmet needs, and what it is to live a life that, you know, provides that meaning. So so I'd love to just have a discussion and stop talking myself.
Michael, are you with us?
Yes, does anybody have a question? It's open to anybody to ask.
Yeah,
Open
Michael.
season.
Michael, this is John Schuneman. I have a question about the workforce centers. Are they going to be adequately funded through this process, because they're essential to aiding employees, or, you know, those seeking work?
Yeah, good question. And workforce centers are a partnership. Most of the funding actually comes through federal funds, and it is a federal program. Boulder County supplements that funding through our general funds. We so far have been able to meet those needs, but I think that'll be where we'll direct some of that ARPA money that we're getting, is to make sure that we do have the funds we need.
Thank you.
Mm-hmm.
Thanks, John. Gordon is talking, but he's muted.
And Gabriella has a question.
I see. Yeah, Gabriella had her hand up. I don't want to violate whatever the norms are of this group, but
Oh, Gabriella is more than welcome to jump in.
okay, you maybe, Michael, you moderate and yeah.
Thank you. My question is, one of the things that were affected through COVID were the volunteering programs for the city and county of Boulder. I am very much interested to volunteer in sustainability and mitigation programs. And do you see those programs coming online this summer, back online?
Yeah, I don't know. We're in terms of volunteers, really following the direction of the Department of Public Health, and you know, when is it safe to have, you know, a certain number of people together. And at this point, we're not engaging with volunteers, but I think, what area are you interested in volunteering? You said sustainability. Is that primarily where you're?
Risk assessment and mitigation.
Yeah.
For example, slopes that were affected through the fires last fall.
Yeah. I don't know the answer to that. Actually, I think we are, were it not for the pandemic, we would definitely be wanting volunteers to help with reseeding efforts. We're doing some helicopter mulching in the Ohio Valley Ranch, because those slopes are steep. That's a real priority, because the runoff will affect the Left-Hand Valley Water District. My understanding is that at this time, we're not using volunteers on that, but that would be through the Parks and Open Space Department. And I think probably the website is the best place to monitor that. There's a group that I volunteered with several times, Wildland Restoration Volunteers, which I think the county has used as a sort of a point of entry. And so, do you know them, Wildland Restoration Volunteers? They're
But I'm going to look for them.
yeah, look them up. And because I think if if volunteer opportunities are available, I spent a lot of time pulling Mediterranean sage on North Table Mountain. It's not, it's, your fingernails are going to be dirty, and your back may hurt from that
That's
work. But
great.
yeah, but that's where I would go to find out. Yeah.
Thanks.
Mhm.
Thank you, Gabriella. That's nice questions. And let's see, Gordon, did you have something or?
Perhaps. Claire, I'm a student of public administration, and how much discretion do you have on the local expenditure from the federal dollars as compared to hands tied federal policies? Money has to go to this, and not that.
Yeah, that's really the question right now. And so on this ARPA funding, we're given broad direction. We're still waiting to hear a little bit more detail on accountability on that, but these are not federal programs. It's money to help with recovery. And so I think we're going to have quite a bit of discretion. We are going to have to track that money very carefully. So, as between programs that our Department of Housing and Human Services run, which are, federal programs that have specific dollars with specific eligibility rules and things like that. That's not what this is. So we've got a lot of discretion in that regard. And the same goes for municipalities that have gotten a direct allocation under that.
Lauren, go ahead, Lauren.
Thank you. Claire, thank you so much for an excellent informative presentation. One of my areas of interest is that mental health and substance abuse area, especially as related to suicidal ideation and so on. I just added this to my personal map of what are my high priorities. And so I'm curious as to, I would like to know more how I can plug in there. I've done a whole lot of training in trauma-informed practices as related to teaching, but also just in general. And so I don't know that it's a question you can answer right now, but it's an area that I would want to plug into.
Well, so the organization that I would identify that if they can't use you, then they might be able to tell you who could, is Mental Health Partners. Are you familiar with them?
I am.
Yeah, because they're probably the biggest sort of umbrella organization. And so if you have any degree of training and can do, the kind of peer-to-peer counseling, they, I think, could connect you with opportunities to do that. I'll just say this is not something I have expertise in, but it's something I've been very interested in. And there is a group, Representative Judy Amabile, who was just elected to the state legislature, actually for the same seat that I once held. She initiated a community group that is working on whether to put a mental health or a behavioral health tax issue on the ballot. And so she has really convened this community group and to try to bring that forward. But I think what we're seeing is that, yes, we need people with really specialized skill, licensed clinical social workers, psychiatrists, therapists. But there's also that mental health first aid concept and peer-to-peer counseling where, you know, it doesn't have to be a highly skilled person. Some training can allow you to be very effective, you know, in a certain community. So I would connect with mental health partners and see if they can put your skills to use.
I will do that. And then the bigger question, and this is a long time issue, and as you said, it's amplified by the pandemic. How will funding get to people who don't have access to mental health services? It's a huge issue that
Yeah.
the disparity in wealth and access. Yeah.
Well, so Medicaid is the biggest funder of mental health services, and Mental Health Partners has the contract to provide those services, and Medicaid is available to people who are at 130% of the federal poverty level and below. There's, you know, some people would tell you that the shortage is in providers, and if we had more providers, we could meet that need. You know, there are mental health parity acts both at the federal level and at the state level that say that private health insurance plans have to have parity between physical health and behavioral health, but we're really not there. Part of it is because the insurance industry has to really understand what does parity mean, and limiting the number of visits you can have, or requiring that those providers treat symptoms and not underlying causes, and things like that are really important. So the details of what parity actually means are still being worked out. And need to be addressed. But the other issue is a shortage of people in this field, and encouraging more people to go into behavioral health and provide their services to lower income people, people in crisis. And so, you know, we have some people would tell you that yes, there's a funding problem, but that's not really the primary problem.
Claire?
Thank you.
Christine has something.
Thank you, Lauren, for those really good questions.
Yeah.
John, what did you have to say?
Christine has something.
Okay, just want to do a follow-up question for Lauren, for Lauren's area of what she asked about. Are there any training? You mentioned training. Where's the training funding coming in? Who's that available to exactly?
The workforce training?
Well, related to the mental health and like peer-to-peer counseling type things.
Yeah, I don't know is the answer on that. Yeah, I don't know the answer to that.
Have you ever come across, and I don't know too much about this area, but let's say the Mental Health Partners is contracted out to do this work. They hire people. Do they have opportunities for their lower end workers who are interested to continue their education in the mental health field, you know, become counselors, get advanced psychology degrees, etc.?
Yeah, they're a service provider, so they would not have the education and training opportunities, but they are a provider, and so if there's somebody who has a counseling degree, they would be able to put that person to work. You may not be in gallery view and be able to see that Christine had something. I think she wanted to comment on this subject. So
I'm not seeing anybody's hands on my side.
Yeah, I think Christine had something she wanted to contribute.
Okay, Christine.
Thanks. Thank you, Claire, for your presentation and all the useful information. I have, in the spirit of networking, you mentioned Boulder County considering the additional tax that would go towards mental health services, maybe training providers, whatever the program looks like. So I don't know if the person who's leading that charge is in touch with Larimer County and Lori Stolen.
Mhm.
But okay, so
Yes.
yeah, Lori has a great story about how she worked to get that done here. So
Yeah.
okay, good.
Yeah, no, thanks for mentioning that because yeah, definitely we are. I've become the designated point person for this concept.
Oh, okay, good.
Yeah,
Good.
and at least within the county, I'm not leading the thing. Representative Amadale is really leading it, but I'm the person inside the county. Yeah, so Larimer County, for those of you who may not know what Christine's referring to, Larimer County put a tax measure on the ballot. It failed the first time, it passed the second time. They're using the funding initially to build a one-stop shop place for a whole continuum of mental health services, and then it will fund those services ongoing. City and County of Denver has passed a dedicated behavioral health tax. I think San Miguel County has, Summit County has, and so we're looking closely at what they did. I think the stage we'll be moving into is really trying to do a needs assessment to see what the gaps are here in Boulder County, so that we really know that we're going to be addressing those needs.
So I also wanted to mention, in answer to a question I think Michael had, Thompson School District did a training for parents for youth prevention of suicide. It's called Assist, and there may be other school districts that are providing the same kind of training. So I just wanted to mention that. So it's ASIST, and it's youth mental health first aid. So, and that was free. And as a parent, I went and took it. But yeah, that's a potential resource through school districts. You may be looking for something more elaborate, Lauren, but that's just a program you might seek out. And then I really had a question for you about the planning for the ARPA funding. So is that set in stone beyond the areas that you mentioned, or have you just identified the areas where that funding will be issued in Boulder County?
Yeah, thanks for asking. The planning is really still in development. Those areas that I identified, those are the areas that that the bill and the U.S. Treasury have said we can use that money for, and then it's going to be up to Boulder County to decide how to allocate it among all of those allowable uses. We really only got a firm sense of what the money would be, how much, and what the allowable uses are last month. And so we had an initial meeting of department heads and elected officials. We are going to, we want to coordinate with the municipalities in Boulder County who also received a direct allocation, so we don't duplicate services, so that we can maybe have some synergies and partnerships there. And then really as important is to host some community-wide conversations with nonprofit organizations, with community activists about the needs that they've seen through this, because it shouldn't be, we don't want it to be a top-down concept. We want to make sure that we really speak to the communities that have suffered those losses, and that includes the business community as well.
Okay, thank you.
Yeah, thanks for asking.
Thank you, Christine. I couldn't see that you had a question. I apologize for that.
It's okay, Michael.
Okay, and if there's any emails or links you'd like to share with us on top of the assist, please put them in the chat. And I just want to do a reach out to Arthur Howe, just so we don't lose him at the end. And so I was going to see if Arthur Howe has any questions for Claire. And Arthur, you're welcome to join us for the leadership team meeting time afterwards. if only for a couple of minutes, we'd really like to have you just to touch base about how Mountain View is doing. But
Sure.
Arthur, would you like to ask Claire a question? And Arthur is connected with Mountain View's Green Earth team, and they put solar panels and efficient lighting and made all kinds of improvements. He'd like to do things like geothermal maybe in the future, but and Elise Jones had the previous Boulder County commissioner had been in contact and had dealings with Arthur in the past.
Sure, yeah.
Well, as has been said, we do have good relationships between PACE and we're very impressed with the efforts that Boulder County are doing to address climate concerns. And I want to thank you for your talk. I'm not familiar with these topics, but I found them very informative, and it was great to see how the county is responding, and I think you gave us a great deal of trust in the way that this whole effort is being pursued. So thank you.
Well, thanks. Thank you for that thought. And yeah, I think from what Michael has told me and what I've seen, Elise Jones's talk, which was in a different era, was really about all the programs that Boulder County has to work on energy efficiency and sustainability across the spectrum. And that is thanks to a sustainability tax that the voters approved. I think it was it 2000, I forget what year it was, 15 perhaps, that is allowing us to do, to partner to do solar panels on roofs, help develop solar gardens, energy efficiency consultation programs, working on local food and sustainable agriculture, because agriculture is a big, is one of the ways in which we're going to be able to sequester carbon, and making the agricultural sector more sustainable. So lots and lots of programs there. And I understand from Michael that you probably are going to have somebody from from OSCAR, our Office of Climate, let's see, I'm not going to try to say it, Sustainability, Climate Action, and Resilience, come and talk to you and elaborate on all of those programs.
Well, we've just concluded submitting our Boulder Performance Ordinance process, and we've had an ASHRAE Excel audit, and I'm very impressed with the way the city, and I presume the county is involved in this too, in trying to document and set targets for the march to sustainability. It's a very seriously thought out program, and it does make you think and do things, and we're replacing our fluorescent tubes with LEDs and so on. So I really think that the county and the cities are doing a great job.
Well, thank you. I'm glad to hear that. And one of the things that we can sort of be a demonstration project right here at the county level that is an example on how do you scale it up. And when the climate issue just can seem pretty overwhelming, when you think about the fact that we've had these goals for ever since the Paris Climate Accord, and even maybe before, and the data does not show that we're doing very well on making progress. But if we can put a lot of programs out at the county and municipal level and show how they can scale up, then we can start to make some real progress. Gabriella put a question in the chat here. She asked, from all the measures Boulder County took during the pandemic, what are the ones the county should preserve to tackle other emergencies? That's a really, really, really important question. And thanks for asking that. Some people at the county will talk about how we've really been in one emergency, oops, there's my dog, after another, since, I would say, since the Four Mile Canyon fire in 2010, which at the time we lost 149 homes. And that was the biggest loss of homes in a Colorado wildfire, and that was 2010. Well, now we've just totally eclipsed that. My dog's telling me she wants to go out. And we went from that to the floods in 2013. We are not finished actually recovering from the flood. We're still doing improvements. The very last segment of road that has to be rebuilt is State Highway 7 from Lyons up to Allens Park. And, now we have the Cameron Peak fire and the Calwood fire. So, we unfortunately we've been in emergency mode and learning for a long time. And I think one of the there's like the budget side of things where we are trying to rebuild our emergency reserves because when you're fighting a fire, you're spending $1.5 million a day. And so we're trying, even though we have a lot of budgetary needs in the county, we're trying to get that reserve amount back up to $40 or $50 million. It's down at around $25 million right now, and that's not enough. The other is to maintain the community outreach ties. So Marta Lochamin, the other commissioner who was elected in 2020, along with myself, she was contracted by the Community Foundation of Boulder County to do a program called Resiliency for All during the flood, which showed how the monolingual Spanish-speaking community was really not primarily in Longmont, in very flood-prone areas, places that were really devastated by the flood, did not have access to information about flood recovery. Their housing needs weren't met. And so I think what she put a report together called Resiliency for All that has some lessons learned about community outreach and the cultural broker program that we have, and making sure that those ties are strong and that we really do that community outreach so that we understand the needs of our community. Every emergency is different in terms of who it impacts, but those are a couple of things that we've learned that I think we're going to carry forward.
We should let Claire go take care of her dog.
Oh, well, I'm not the only one here. So, but she thinks I'm the only one that can take care of her needs. She's lying down. She's happy.
Thank you.
Yeah.
Thank you. And anyone? Oh, sorry. Anyone else that we missed?
Yeah, I should wrap up. I have an 11:30, and I do need to just catch up on the email before I get to the 11:30. And I want to be respectful of your time as well. But
sure. Claire, I just want to say, thank you so much for being able to be here, and thank you all the more for a super talk. And I hope you have a great rest of the day and week and year for that matter. So.
Life. No, thank you. Thanks for having me. And thanks, Arthur, for showing me how to get the right screen up. So it's an important skill to have. No, it's really been a pleasure to meet you and hear all the background that you all have. I wish you all success in finding the job that you want. And I hope that you all, through this networking, stay connected with one another, and keep those relationships. So take care and be in touch.
Thanks.
Okay, bye-bye.
And anyone who wants to join